of those border states. And that's why people are so frustrated about illegal immigration there, because it's affecting how they get health care, how they do work, and all of that. But it's a real problem. And so if you're practicing medicine as a provider of any kind or running a hospital, and 1 in 4 patients don't have insurance, you're stuck, because all that cost is being transferred to people with private insurance. And so it's called cost shifting, and that's a big issue too. Let's have the next slide. And this is why people really want a single payer system. They want to cover everyone, but sometimes that coverage may not mean too much. You know, if no doctor will take the insurance, is it really good insurance? That's my fear with single payer coverage. Let's have the next slide. Let's skip this if we can. Oh, I'm sorry, hold it right there. Yeah, this is the point I wanted to put in. We have about 45 to 60 million people in the U.S. without health insurance. Who are they? Well, a third are children, and if their parents signed them up for S-chip, they would be covered. Fran, are you going to cover this also? A little bit. Okay. 25% are young adults, and they're choosing to spend money buying a house or renting an apartment out of college or getting a car instead of buying health insurance. And for the most part, unless they have an accident or a pregnancy that's unplanned, they will not really need health insurance. You can argue that they're making economically good decisions for themselves. 30% of the people without insurance have enough income to buy it, they just choose not to. Most of these people are without insurance for under a year as it goes. And about 16 million, the last time I did the numbers, are chronically uninsured. So if we're talking about covering the uninsured, 16 million is an easier goal to get to than 60 million. But again, what is the motivation of why you're doing this? Is your motivation to change the social fabric of the country? If so, you aim for the big number. If your motivation is to truly cover the chronically uninsured, for whom no program exists, then 16 million is an easier number. Let's have the next slide, thanks. Businesses need predictability for benefit costs. Let me share a fact with you that will shock you. Next slide. General Motors in 2005 covered 1.1 million people with health insurance, both active employees, retirees. And that year they were expected to spend about $5.5 billion on health insurance. $1.5 billion was on prescription drugs, and that averaged about $4,200 per person on health care. Pretty reasonable cost, amazingly, but it's a lot of money. They averaged it out over each car, so every automobile they sold had an additional $1,525 at the sticker just for health insurance. Okay? So GM was very worried about this. They figured that if they could persuade people who were going to retire from GM at age 65 to just take Medicare by itself and not the GM supplement, they could pay those employees $140,000 in cash and come out ahead. So this is why businesses are driving for healthcare reform too, because they need predictability and cost. Let's have the next slide. Here's another slide given to me, or I picked up from Dr. Reinhold out of Princeton. If you look at the hourly manufacturing wage, what you make per hour in a manufacturing job, in the U.S., we're in the orange. It's about, what, $17, $18 an hour. If you work in Germany, you get 25. These are all in U.S. dollars, okay? And we're pretty comparable to the world, to at least the G7 nations. But if you look at the healthcare costs, the U.S. and France really have the highest healthcare costs per hour. And so the manufacturing companies, the Fortune 500s, are telling the Congress that healthcare costs per hour make them less competitive, and so they need reform so that they can sell products more cheaply and get that healthcare cost off their back. So this is why businesses are pushing for healthcare reform as well. Let's have the next slide, Bruce. What do doctors think about the whole thing? Well, I think it's a mixed reaction. Many physicians, other medical professionals, agree that changes have to occur. None of us are happy with the chaos that currently exists. And a lot of the providers are not getting paid. You know, 1 out of 4 patients doesn't pay them, so they're frustrated about that. They're having to charge more to everyone else to make up for that. So that's why physicians and some physician groups are so aggressive about wanting certain aspects of coverage to occur. Then the next slide, please. Okay, next slide. I showed you that. This is what I fear. I mean, this is a little bit of hyperbole, but I think it's reality. And I think in about 5 years we'll compare this slide to the reality of where healthcare reform is. But this is what I fear about healthcare reform: that we've taken something that is complicated now, we're going to make it even more complicated by having all of these committees and other people standing between the physician and the patient, or the healthcare provider and the patient. Okay, so the next slide. Well, What we're debating in society, or in the U.S. at least right now, is number one, how can we cover all Americans with insurance? Two, how can we control cost? And three, and I think a bigger debate, is what is the proper role for government in managing cost and insurance? Okay? Many of us philosophically think the government should have a less dominant role, not a total role in doing this. Some believe the government should have a big role in this, and they have their arguments, and we have ours. Next slide. And what does the ideal healthcare system look like? Well, it's depending on your perspective. If you're from the United Kingdom or Canada and you're happy, well, you may want a single-payer system. If you're an American, generally you want a system that is privately insured and has somewhat of a free market approach, meaning individual practitioners charge their fees and there's a give and take between consumers. And I think you also have to decide what is the biggest goal. Is it universal coverage or near total coverage? Or is it really to have a lower cost system but a higher value system and still give patients a lot of autonomy? Let's have the next slide. This is kind of what healthcare looks like today, and it's not all bad. You go to different specialists or different areas to get things. You have a diagnostic center, you have a foot clinic, an eye clinic, you got a pharmacy, you got a minute clinic or a quickie clinic, and those work pretty well. And then you have places to get health advice, and then you got a little hospital there, the We Care Hospital you can see, the smiley doctor standing on the side of the building, and the ambulance is running around. So we have a complicated system in the U.S., but it works reasonably well. I don't see Americans lining up to go to Cuba for health care. Except maybe Michael Moore, yeah. I've had a colleague go to Cuba and look at the healthcare system, and it scared him. I've had friends in other countries who could legally travel there, go and look, and it scares them. No one wants to get their care there. They feel sorry for the Cubans. It's 1950-style medicine. And no matter how much some people want that, we can't go back in this country to that. Next slide, please. Some people want a Canadian system, and we kind of have that with Medicare. Medicare works pretty well if you're not sick for too long. But if you're in the hospital for more than 90 days in a year, you're out of luck, aren't you? You're stuck with the whole bill. They bankrupt you. That's a great system, isn't it? I don't quite understand how Medicare evolved to that, but it has. Let's have the next slide. Well, I think the issues really do center on two things, controlling cost and expanding coverage. Let's have the next slide. Well, you hear a lot of talk from the president and the congressional leadership on how we can save money, and I like to say how we can save money and other myths. One is to put all Americans into a medical home. Well, it's a great idea for all of us to have a healthcare professional, physician, PA, NP, taking care of us, being our champion for our health, helping us manage our diseases. But they don't work for free, and you get what you pay for, really. If you get it for free, it's probably not worth that much. So the truth is, putting everybody into a medical home will drive cost up. Let's imagine this. Let's say that we have a fixed supply of hamburger, and suddenly everybody gets an extra $100 in coupons to buy hamburger next week. But there's only so much hamburger to go around. What will happen to the cost of hamburger if more people want to buy it and there's only so much to sell? It goes up, yeah. So what will happen to healthcare costs if everyone has insurance and there's still about a fixed supply of hospitals and doctors and nurses? Costs go up. That's how the market works. It's like if I drop this microphone right now, it would fall to the ground. Supply and demand, and it's going to happen to healthcare. You can write this down, my prediction. We provide universal coverage, but no meaningful market mechanism to control cost. Cost will go up. Twice the inflationary rate it is today. If I'm wrong, I'll buy you dinner. Next slide. This is one of those real stubborn facts kind of slides. This was put together by Dr. Doug Wood and then adopted by the Minnesota Transformation Task Force. We're told that if we